Sir, please explain Scott's kinematic at ankle joint.
Okay, so you want to understand the Scott's kinematics, right? So kinetics at the ankle, right? So to understand this Scott kinematics and kinetics, we have to understand ankle joint properly, right? So let's draw the ankle joint. Basically, this scotting movement at the ankle is carried out or facilitated by talocrural joint. Facilitates the plantar flexion and dorsiflexion, right? And subtalar joint maintains postural stability. Right? So let's understand what is talocrural joint. So we have tibia, right? And the fibula. And the tibia and fibula, this is tibia and fibula. They are resting on a bone that is called talus. This bone is called talus, right? So where these two bones are making contact, this joint surface is called talocrural joint, and this talocrural joint facilitates the plantar flexion and dorsiflexion. Now, this is your calcaneus bone, right? And here we do have navicular bone, and then let's understand this. Now, plantar flexion and dorsiflexion, they occur at the ankle joint. If your feet is getting, pressed down, you get plantar flexion movement. Which is up to 50 degrees, right? And if you take your toes upward towards the sky, this is called dorsiflexion, right? Up to 20 degrees. So talocrural joint facilitates the plantar flexion and dorsiflexion while getting into the descent phase of the Scott, right? And subtalar joint maintains the postural stability. What is subtalar joint? This talus bone, what you see here, right, forming a joint with calcaneus, and this part is called subtalar joint. This joint is called subtalar joint, and this subtalar joint maintains postural stability. Now let's understand with this squatting form. Suppose this is a squatting position, right? Deep squat, and this is the weighted. This scapula should maintain a relationship with the subtalar joint while squatting. So this is scapula here, right, where you place the bar, right? The S and S relationship should be maintained during squat, right? The subtalar joint need to be maintained this line during squat. So subtalar joint maintains the posture stability during this squatting, right? Now let's understand what are the ligaments. The ligamental structure here, the main ligament is called deltoid ligament. Right? Now, the ligaments from tibia on to the navicular bone. This is called navicular, right, bone. The fibers coming from tibia on to the navicular, that is called tibio-navicular ligament. That is called tibio-navicular ligament. The fibers oriented from tibia on to the talus bone. This is the talus bone, right? This is called tibio-talar ligament. Right? And this orientation of this fiber onto the calcaneus from tibia is called tibiocalcaneal. So they are forming nice triangle. That's the reason it is called deltoid ligament. They manage the load, and they most probably in squatting the forces recorded at this joint is somewhere from 50 Newton meters to 300 Newton meters. Forces are counted in Newton meters, right? They are very low compared to the knee and hip, right? Let's understand the muscle responsible at this joint. That is called triceps sura muscle. That is called triceps sura muscle. Right? Triceps, three-headed, gastrocnemius and soleus. Sura means a sural nerve which is innervating this muscle. So tricep, two-headed, gastrocnemius and soleus. Right? This is called three-headed muscle. Then sural nerve. Sural nerve innervates this muscle. Let's understand the placement of this muscle. This is, let's make. This is your calcaneus bone, and this is talus. Right? On top of that, we have tibia. and beside this we do have fibula. Here on top we do have femoral condyle, right, and this is femur. So this is medial femoral condyle and this is lateral femoral condyle. The triceps sura muscle, two-headed gastrocnemius, originates posteriorly from this condyle and attaches onto the Achilles tendon, onto the calcaneus. This forms a head medially, right? So this is medial head. And one is coming from the lateral condyle posteriorly. And this is forming lateral head of the gastrocnemius, right? And the soleus is centrally present, which is originating from posteriorly onto tibia proximally and inserts onto the Achilles tendon. So this is soleus. These together they are called triceps sura muscle. This triceps sura muscle contracts concentrically during plantar flexion and eccentrically during dorsiflexion. Right? This two-headed gastrocnemius and soleus. Soleus is pure plantar flexor during squats, right? And gastrocnemius does knee flexion and plantar flexion, right? So I have already illustrated here that this is the plantar flexion and this is dorsiflexion, right? Now, who does then the dorsiflexion? Tibialis anterior muscle. Which is on the anterior side. We are seeing the posterior aspect. On the anterior aspect, we do have tibialis anterior muscle responsible for dorsiflexion. Right? Now, both together, gastrocnemius and tibialis anterior. Let's understand them both. Gastrocnemius and tibialis anterior. Both stabilizes the ankle joint. Ankle joint during mid-range or mid-phase of the squats. During mid-phase of right? Now, what else can we add here? We have understood that tricep combination of two-headed gastrocnemius and soleus muscle contracts concentrically during plantar flexion, right? And eccentrically during dorsiflexion. Now we have understood the soleus separately. It does pure plantar flexion, right? And gastrocnemius does knee flexion because it is biarticulate muscle. It is crossing the ankle joint as well as the knee joint. So it functions in two ways. So it does knee flexion as well as it does plantar flexion. Why these two joint flexions are essential here? Whenever during squat, the proximal muscle generates the energy force has to be sent onto the distal joint, whereby again it is done as a reversible sequence, right? So ankle joint is the prominent in transferring the force, right? So does this biarticulate muscle works? It transfers the flow of energy into the mechanical energy at the distal joint, and that again works as a reversible, right? Now, tibialis anterior present anteriorly and it does pure dorsiflexion. It is present anteriorly, right? Now, gastrocnemius and tibialis anterior both together stabilizes the ankle joint, right? Again, we can see the gastrocnemius function here. In the mid phase of the squat, this stabilizes the ankle joint. What? When we are on the flat-footed squat, when we are doing flat-footed squat, when we are doing flat-foot squat, the load on ACL, let's understand the load on ACL. That will be in descent phase, ACL load is somewhere from 26 plus minus 31 newtons, right? And in ascent phase, in ascent phase, ACL load is somewhere from 28 plus minus 38 Newton meters, right? If you add some shoes like having high heel, then that's going to be problem. Because ACL load will increase from 50 to 90 Newton meters. So you should avoid keeping your heel high, right? It should be flat feet. Then prior going into these squats, at this ankle joint, a mobility stretching need to be added. That is at the Achilles tendon, which is sometimes remain tight, which is attached onto the calcaneus, right? Suppose this is the thread. This is the thread of Achilles tendon here, right? This Achilles tendon need to be stretched. You have to get it into the mobility to prevent the injury. So you can keep your feet extended and flex at 15 to 30 degree and give the Achilles movement. So this thread do not remain tight. And if you want to add some resistance band stretching, then that resistance band, suppose this is a resistance band color, you have to keep it on to the navicular bone. Suppose this is your resistance band, right? This has to be on to the navicular bone and have to go into the lunge position and just drive your knee forward without lifting the heels. Don't try to keep your resistance band here at this joint. This will create mechanical disorder. So this kind of stretching can be added for the mobility. And in next lecture I will cover how Scott's kinematics and kinetics are in the knee joint. Thank you very much.